Numerous outbreaks of diseases throughout history have shown that at the early stages of a virus spread, hysteria and panic can escalate. Try to remember that in recent times we have encountered and survived foot-and-mouth disease, Ebola, swine flu, bird flu, and hepatitis, among others. And each time international society has hoped that the disease will stay ensconced in some other state or territory, or perhaps within a social group. But we live in a too tight world, and it is almost impossible to stop immediate migration of people and the movement of goods around the globe. It is simply not possible to control everything. However, at a social level, humanity creates what they call social distancing and quarantine, forced or voluntary. This remains the most effective way to shield the most vulnerable during this outbreak. Those social factors play a major role in vulnerability to disease. During quarantine, especially a strict and long-term one, the whole state system, all infrastructures, including services and economy, starts work differently, and it even can have breakups which cause discontentment and complaint and may lead to hysteria within a society. Hysteria adds to stigmatization of the disease and patients. If this becomes the case, a sick person will be less inclined to admit the illness or seek medical help, which both aggravates their condition and increases the spread of the disease. Beyond physiology, how society treats its vulnerable population plays a big role in their risk from disease like COVID-19. You can be socially isolated without reporting feeling of loneliness, and you can be lonely without being socially isolated. Over time, the hysteria ceases to manifest itself, and there becomes a natural process of adapting of our minds to threat and new rules. But there can often remain a bitter taste of shame for one's behavior, which can last long after matters are stabilized. There are several reasons why the early panic ceases at some point, and the main ones are: first, we get more clear information about the disease and start thinking that it is completely under control. Second, state infrastructures start operating with no breaks and we adapt to new rules. Third, due to the process of our mind adapting to the threat, the topic becomes overused and the media stops exploiting it. Thus, it becomes less of a threat. Of course, during such times, all of our reactions are normal reactions to new, unusual circumstances, which is a part of a process of our adaptivity to new conditions. One of common emotions we have in such circumstances is fear and anxiety. Anxiety caused by unclarity, and of course we have fear of disease. Having said so, just think that as we know, hundreds of bacteria and viruses attack our bodies every hour, and our immune system copes quite well. We often do not think about this. We don't see this process outwardly, but if we start to think of a disease, our thoughts can cause some sensations in our body, such as pain in joints and muscles, sweating, nausea, and skin rashes. These are just some of the more common physical symptoms caused by anxiety and fear of getting sick. It is not a big step to having constant thought of a disease, and this can develop a type of anxiety disorder called hypochondria or nosophobia. The difference between these two is small. Hypochondria is a common fear of disease, while nosophobia is a fear of a specific disease. In this case, we mean COVID-19. It is worth noting that since 1965, 40 types of coronavirus have been known about, but the widespread hype only really began in 2002 with the outbreak of SARS. What is the risk of this anxiety disorder at the time of COVID-19? The fact is that frequent thoughts about the disease cause stress, and it can become chronic. Chronic stress suppresses our immune system, and in addition to this, the impact on mood and loss of concentration, along with inability to work, study, enjoy life. So we essentially have a vicious cycle. Thoughts about the disease may cause the disease. What can we do about this? First, schedule news intake like twice in a day. You can do it in the morning time, spending like 30 minutes, and evening time, but not later than 4 hours before you go to sleep. Do not spend the day scrolling down social media. You may think that you are not affected by disturbing news, but our brain always records all negative information in order to protect us, and brain does it quite automatically. Now, you already knew how our thoughts affect our immune system. Second, always filter news by questioning it. Check the competency of the source. Is it a fact or is it just an opinion? At stressful times, we tend to be driven by our emotions and opinions, which create a vicious cycle by fueling each other. Our emotions strengthen our opinions, which in turn intensify our emotions. Same happens to all human beings, including journalists, scientists, and politicians. So you can always challenge the news by checking, is it a fact or it's one of the theories? Is this an author's area of expertise? Are there different sources having other points of view? Are there evidence that proves and disapproves these news? Ask yourself, what does this news give to me? What can I do for myself, for my loved one, for my community about it? Third, take into account only verified information and statistics. Important not to ignore the positive sides of the problem. For example, latest figures show that total number of infected people is 80,409 people, of which 53,392 people recovered and were discharged from medical facilities. Unfortunately, 3,286 people have died, and all countries start to implement strict quarantine measures. Did you notice any positive in this news? The fact is that in fear, our brains ignore the objective picture and pay attention only to the negative side of events. We heighten our mania by going to the extreme end of the problem. For example, the virus is scary, it's already in the country, there are diseased people are dying, my immune system will not survive, I will be infected, there will be certainly complications, serious complications, extremely serious complications, fatal complications, I will die. Don't you think that chain of thoughts is too long and requires too many negative matches to be realized? Another thing, for instance, the World Health Organization will introduce a level of threat to public safety. For some people, that means that everything is very serious, we will die. The fact that the WHO and governments of countries have allocated huge resources to fight the disease is ignored. Think about what they know how to do it. Do they have examples of successful control over the spread of infections? Think about the plague, smallpox, Ebola. The WHO have worked successfully to put in place measures that contain this disease. And in this instance, the WHO and the whole international community are doing the same thing. Lots of things could be done for your part. First of all, do not blame and stigmatize those who are sick. It is not their choice and it is not their fault. Do not use terms like carriers or infected. The stigma of the disease makes people hide the disease in order to avoid shame and prevents them from seeking immediate help and deprives them of social support and understanding. And that only serving to exacerbate the cause of the disease. Second, if you need to diffuse your own anxiety and fear, please talk to your loved ones. The way you feel is normal, and to talk to people closest to you is always a good way to cope. It is natural that we speak about both disturbing and positive news to others. Listen to others. However, you should try to use wrap-up questions like, what can we do? When do we start? For example, ideas could be like, let's check and verify information and only use information from trusted source. We'll take precautions and start to strengthen our immune system. We'll talk with the experts, preferably medical staff, and with positive thinking. We will not spread rumors. We will pay attention to our own negative thoughts, and if they appear, we can change them with more positive thinking and positive planning, which in turn will bring us pleasure. Of course, we will not avoid talking about COVID-19, but we need to consider the numbers of those who have already recovered, not just those who have died. Remember, the vast majority of people who have tested positive have gone on to recover. You may complete the list of your actions and share it with your loved ones. To put down an action plan on a paper is great exercise to deal with anxiety and intrusive thoughts. Fear is a normal reaction to an abnormal situation, such as an outbreak of the epidemic and other crisis situations. And our emotions may include not just fear and anxiety, but also sadness, anger, confusion. However, in place of these emotions may come relaxation and enjoyment. So how do we deal with anxiety, fear, sadness, anger, and confusion? Most importantly, search for solutions to the problem. Do not give up. Do not stop thinking for a way out. Do not think there is no way out. Do not ignore the reality. Do not pretend the problem does not exist. Do not spread rumors. Please do problem solve. Do what is right. For example, follow instructions for health and hygiene. Do follow expert advice. Do speak only about verified facts. Do report problems, do seek help, and do support others. Please do not shift responsibility to others. Do not complain that everything is bad. Do not panic. Do not isolate yourself completely, and do not stop communicating with loved ones. You can use telephone, internet, etc. Please do analyze, understand, and accept your own emotions. Do talk about how you feel. Do calm down. Do accept the offer of help. Do show and encourage optimism to others. Do collaborate and do support. Please do not continue negative thinking cycles. Do not exaggerate the level of threat. Do not downplay the importance of the necessary measures like quarantine, hygiene, treatment. Do not ignore official recommendations and do not ignore official procedures. Please note, this is very important. Do focus on pleasant activities and positive thoughts. Focus on your work, studies, hobbies, sport. You can use the internet to self-educate. More often, build positive plans and try to remember something positive. Adapt and, if necessary, avoid and change habits and routines which lead to negative thoughts. One of the healthiest ways of coping with the distress is to focus on supporting others, those who are in need. Elderly and lonely, those who don't have proper social support may need your listening ears, helping hands, and caring hearts. Please remember and follow these recommendations. There may still be question, and in particular, could I get sick? The simple answer is yes, of course, you could get sick. But remember, the statistics show that you will recover. Living and thinking about illness and about constant threat and disasters is unbearable and can be very harmful. We live in a world of constant uncertainty and without any guarantees. But this does not mean a negative outcome. In fact, it means there is a world of possibilities out there, and much will depend on whether your approach is positive or negative. It is important to focus on what we do know. If you feel unwell or feel that your mental health is suffering as a result of this latest epidemic, please contact professional support immediately. Take care.